let's start with the intrapartum care now. The time and mode of delivery of any diabetic patient should be decided by the third trimester. If the woman is type 1 or type 2 diabetic, she should be delivered between 37 and 38 plus 6 weeks of gestation, either by induction of labor or cesarean section if it is indicated. And it can be delivered before 37 weeks of gestation if there are any metabolic, maternal or fetal complications. In case of a gestational diabetes mellitus, the cases those are uncomplicated, they should be delivered by 40 plus 6 weeks of gestation, and if they have not yet delivered at this gestation, then induction of labor or cesarean section if indicated should be offered. And they can be delivered before 40 plus 6 weeks of gestation if there is any maternal and baby complication. There is no contraindication to vaginal birth after cesarean section in case of diabetes alone. And if there is an ultrasound indicated macrosomia, then counsel the patient regarding the risks and benefits of induction of labor, cesarean section and vaginal delivery. Well, any woman who is a diabetic patient and she is having any associated comorbidity, that is if she is obese or having autonomic neuropathy, then the anesthetic consultation should be done in third trimester. If the female received general anesthesia during her birth, the plasma glucose levels should be checked at every 30-minute interval till the baby is born and the patient is fully conscious. How do you monitor in the labor and birth? Well, all diabetic females should have their 1 hourly check of blood glucose levels, and with the aim of keeping the target blood glucose levels between 4 to 7 millimole per liter. If they are type 1 diabetic, then you have to consider the IV dextrose and insulin infusions, and IV dextrose and insulin infusion should also be given in cases if the female is not maintaining the plasma glucose levels between 4 and 7 millimole per liter. What about neonatal care? Well, the woman should get delivered in a unit where there is a 24 hours neonatal resuscitation skills available. The plasma glucose levels of a neonate should be checked after 2 to 4 hours after the birth, and if the clinical signs suggest that is polycythemia, if the clinical signs suggest, then testing for polycythemia, hyperbilirubinemia, hypocalcemia and hypomagnesemia should also be done. Perform echo in a patient, in a baby, if you suspect that the baby is having congenital heart diseases or cardiomegaly, and that is best detected by murmurs.